I am Dr. Tina Tran, and I have been living in the Phoenix area for about the last 4 years. I am currently on faculty at University of Arizona College of Veterinary Medicine, helping to put together our clinical year rotations for our final year students. And then I also am immediate past president of the Multicultural Veterinary Medical Association. This is our older boy. This is Marley. He's a 13-year-old chocolate lab mix that we adopted originally as a rescue from Portland, Oregon when we lived out there, and he's been with us ever since. Marley is about 13 years old, and we have had him since, I would guess, since he was about 4 months old, so for his whole life, pretty much. Our best guess is he's probably mixed with a German Short-haired Pointer. He has a lot of little tufts of white in his hair, and something about his personality is much more like a German Short-haired Pointer than a Labrador. You know, really his story is that at the time that I met him, I was working contract work as a relief veterinarian. He came in and they said, oh, he's part of a rescue and we need to get him neutered and cleaned up and ready for adoption. And they said, well, you know, Dr. Tran, he needs a home, and you just moved to a house that has 3 or 4 acres and you only have the one dog, so wouldn't it be great if your dog got a dog? And I thought, that would be great. And so then we adopted him, and then he assimilated really well into our household and has been a really great addition to our family. In my extended family, I have 3 veterinarians, an aunt and an uncle who own a cat and dog practice outside of Chicago, Illinois, and then I had another uncle who married into our family who also had another cat and dog practice. All my summer breaks, all my winter breaks, any holidays where we couldn't find a sitter were spent in the back of a hospital. So I learned at a young age kind of, the inner workings of a veterinary hospital. I learned how to clean cages and to stock exam rooms. I saw some behavior things up front, up close and personal. All of our pets growing up were given to us by my aunt and uncle. Got to see some really cool surgeries. I have an older cousin that is also a veterinarian. And so I think that early role modeling and that access to a veterinarian who looked like me and could answer my questions was really key in me becoming a veterinarian. And then also love of animals. I'm a very introverted person, so I could spend an entire day just letting Marley hang out with me and I'd be totally fine with that. An obvious love of science, curiosity about all things that have to do with science, biology specifically. So when I first started as a veterinarian, very exciting. I think those first few years out are kind of a mixture of excitement because you're finally getting to do what you've been wanting to do most of your life, but then also this nervous energy of realizing, oh my gosh, now I'm the doctor, and now somebody expects me to have all the answers and to be right all the time, and to be perfect in every scenario. That part can be really stressful, and especially so in your first few years because you're really trying to understand how you function as a doctor, kind of like how you want to practice. And then the part that is you have no control over is how people respond to you, whether it's the staff, other veterinarians, or clients. And so while you may be practicing really good medicine, if the price that you give them isn't what they anticipate or what they can afford, it's really stressful because then it adds this other layer of, well, they didn't really teach me this in vet school because it was more about focusing on the medicine and surgery. There's so many things that are making it very difficult to just be a good veterinarian. Working with individuals that maybe put very high expectations on you as to what you can do to help their pet, the concerns about social media and online bullying, that is very hard to escape as a veterinarian. There are some individuals that say, hey, I want to get out of veterinary medicine, but I have so much debt. I don't know what I'm going to do with my degree if I leave. I think that feeling, that sinking feeling of like there's no way out, my hope is that people become more aware of it outside of veterinary medicine so that they can recognize that, that there's impact there. I would say, one of the challenges I've seen is not related to my faculty position, but I also do part-time work as a veterinary telehealth consultant. So I manage chats, like a few hours every week. And so these are clients that are not my clients. They have another veterinarian, but we are kind of doing the overnight work with them. There's lots of situations where I would say, well, it sounds like that wound needs to be checked out by your veterinarian. I would go in the morning and have that checked out, and they said, well, they told us that it was going to be 3 weeks before we could get in because they are so backed up with appointments. So they told us to call you. I think if anything, it has really put an exclamation mark on the fact that, wow, we really need more people in the field to be able to service all the animals that are out there. Yeah, I think specific to my role within the Multicultural Veterinary Medical Association, it's not necessarily well known that veterinary medicine is a fairly white profession, sitting upwards of 92, 93% white, and has been for quite a while. When I went to veterinary school, which was 20 some years ago, I remember looking across the room at my class of 100, and there was less than 5 people that I could even say looked kind of like me. And when I say kind of like me, I mean they had a little bit of melanin in their skin. And I don't know that I really dealt with any overt discrimination or anything like that, but I just had this feeling like maybe I don't belong because I don't really see anyone that looks like me here. And then I also think of it in terms of for pet owners, is that we are a very diverse population, and if we don't start to see some of that and the people that are helping our animals, are we missing out and not helping people because they don't feel that level of trust? People are graduating with easily 6 figures of debt, somewhere probably around 200 to 250. That's only for the 4 years of veterinary school. So if you can imagine, most people probably have some debt that they're bringing with them from their undergraduate, and so that's on top of that. And then the other piece of that is when you look at the income for a new graduate, the debt to income ratio is really not livable for most people, especially on those early recent graduates, to say, I feel like I'm just going to continue to work and work and work, and I will never really see the light of day with getting myself out of debt in a profession that I've wanted for so long and that needs me, and that's really hard. My support network is fairly wide. Definitely my partner, my husband. My parents for sure and my sister are a very big support network. They've been around animals their whole life and veterinary medicine as far as our extended family. So they're a big support. Friends in college and definitely a few vet school friends as well. And then the Multicultural Veterinary Medical Association, I think that support network has been invaluable for me. It's very validating, I think, to know that the experiences that you have as a person of color in the veterinary profession are not only yours. Like this feeling of loneliness, this feeling of not belonging, this feeling that things are kind of working against you. I can look ahead to see people that have been successful in veterinary medicine, and I look to them to say, okay, if they can do it, then I can do it. And then I can also be that same inspiration for the people that come behind me. I think really giving grace is what would be really helpful, and also to acknowledge when somebody helps you, like when they bring you your pet, or they explain the diagnosis to you, or they explain how to give the medicines. I think even just that really quick, like, hey, thanks, you're doing a great job and I really appreciate you.